How does crowdfunding help with reproductive cancer costs? Imagine facing a diagnosis of reproductive cancer and suddenly dealing with a mountain of bills. Crowdfunding can be a lifeline, helping patients raise money to cover many of these expenses. It works by providing a platform where individuals can share their stories and seek support from friends, family, and even strangers. This approach can be especially helpful for those who lack sufficient insurance coverage or live in areas with limited public aid options. One of the main ways crowdfunding helps is by covering medical expenses. Treatments like surgery, chemotherapy, radiation, and medications can be very costly, especially when insurance does not fully pay for everything. Studies show that most crowdfunding campaigns for gynecologic cancers focus on these direct medical costs. By raising funds through online campaigns, patients can pay for procedures and treatments that might otherwise be out of reach. Crowdfunding also provides support for non-medical financial needs. Cancer treatment often means missing work, which leads to lost wages. Patients may also need help with transportation to appointments, childcare, or everyday living expenses. Many campaigns seek funds for these costs, which can add up quickly and cause additional stress during an already difficult time. Another important aspect is funding fertility preservation. Cancer treatments can sometimes harm reproductive organs, making it harder or impossible to have children later. Procedures like freezing eggs or sperm are expensive and often not covered by insurance. Crowdfunding offers a way for patients to raise money specifically for these reproductive health procedures, helping them preserve their options for the future. Crowdfunding can be especially vital for patients in states where public health programs like Medicaid are limited or unavailable. These individuals often turn to online campaigns to fill the gaps left by traditional aid programs. It acts as an immediate resource, giving patients more control over their financial situation during treatment. Many patients also use crowdfunding alongside other forms of financial help, such as grants, charity programs, or insurance. It can provide quick access to funds that are flexible and tailored to their specific needs, whether for medical bills, fertility treatments, or everyday expenses. However, it is important to understand that crowdfunding has its limits. Most campaigns raise only part of their goal, often less than a third of the total needed. Creating and managing a campaign can also be emotionally and time-consuming, which can be challenging when someone is already dealing with the physical and emotional toll of cancer. Success can depend on social networks, storytelling skills, and internet access, which may not be available to everyone. In summary, crowdfunding can be a helpful tool for managing the financial challenges of reproductive cancer. It provides vital funds for medical treatments, fertility preservation, and living expenses. Still, it is not a complete solution and should be viewed as part of a broader support system. Patients are encouraged to consult healthcare professionals and explore all available resources to ensure they receive comprehensive care and financial guidance during their cancer journey.